Hello and welcome. So, today we are going to start a brand new series known as Medical Cases and Diagnosis. Medical Case Diagnosis. So, this is the first video. Hopefully, we will continue this. So, let us begin. Now, see, this is our case 1. So, mainly, we will deal it in a way that you are like a doctor. Patients will come and you have to deal with them, trying to replicate a clinical scenario. Okay, so let's take the first case. A patient comes to ER with a stomach pain. Okay, patient has come to you with a stomach pain and it's happening since yesterday. Okay, this is the patient with stomach pain. And where is the pain? On the middle and right side. This is complaints of. When you ask the patient about the symptoms, he is telling you all about this. Where the pain is? On the middle and right side, and vomited recently. The patient vomited recently and the patient is suffering from loss of appetite, means he is not feeling to eat anything. Okay, and the age of patient is 29 years, weight is 72 kg and rest all are normal. Means no other symptoms, these are the main clinical symptoms. Okay, now how will you approach the patient? You ask the details, the age, the weight, you checked everything. Now how will you approach the patient? Let us see. Now, as the patient has said, he has a pain in his abdominal region. So, you will first start off with a abdominal exam. What? You will look for any tenderness in the abdomen. There are various kinds of examinations, and we will show you that. What is the main purpose of abdominal exam? We will look for any tenderness, any bulges, or any kind of indications, and then we will look for genitourinary exam. This exam also can be done. This genitourinary pathology can cause abdominal pain. Sometimes when people are sexually much active or there is any pathology including the sex organs, they can cause abdominal pain. And the third is back or flank exam. It checks for severe tenderness, might suggest kidney stones. Severe means costovertebral angle. If there is a tenderness in the costovertebral angle, it might suggest kidney stones. Okay, so this is the clinical approach. Means first approach, you will do a abdominal exam, then genitourinary exam, and then the back flank exam. Now in this case, after doing all this, what the result has come? Okay, in this case, so we are going through this. So first of all, we will go through the abdominal examination. So we can clearly see the right quadrant and the left quadrant. In the right upper quadrant, we check for gallstones, stomach ulcer or pancreatitis. In the middle one, kidney stones, urine infection, constipation, and the most wanted one is this one, the right lower quadrant. It's checked for appendicitis, constipation, pelvic pain, and groin pain. And in the left side, we check for stomach ulcer, duodenal ulcer, and biliary colitis. And like this, you can see what are needed. Now, in genitourinary examinations, we check inflammation, swelling, lesions, or any unusual bleeding or discharges or hemorrhoids. In female, we check the lumps in breast and evidences of prolapse. And in male, we check scrotal nodules or masses and gynecomastia. And for severe tenderness, that is costovertebral angle tenderness, this indicates potential kidney stone or pyelonephritis. To test for CVAT, place the balls of your palm at the costovertebral angle on each side and percuss with a fist with your hand. A positive CVAT is demonstrated when there is a significant pain elicited by this maneuver. So let us see. After examining abdomen, we see a soft RLQ tenderness plus bowel sounds. What does this mean? RLQ means right lower quadrant tenderness. There are 9 quadrants and right lower quadrant means this one. 1 RLQ. This is the right lower quadrant. This is the right upper quadrant, right middle quadrant. Okay, like this. So see, right lower quadrant, a tenderness is felt and bowel sounds are there. Okay, and in genitourinary examination, everything is normal. Normal pain is normal, testicles all are normal, and in back, no tenderness in thoracic or lumbar spine. It is also normal. Now, okay, so what is the generalization? The patient came to you, the patient told about its means symptom and all. Then after examining, you find out all are okay, but in abdomen there is right lower quadrant tenderness plus bowel sounds. Okay, so we now move on. Now we must stabilize the patient. If the patient has anything else or anything not means we will check the things in general. Okay, so the first thing that comes is checking the vitals. Okay, we will check the heart rate, the temperature, oxygen, blood pressure and respiratory rate. So in this case the patient has 117 heart rate, temperature is 38 degree, which is normal. Oxygen is 98 to 100. Temperature 38, it's not normal, slightly high, but we can consider it as normal. Normal is around 37, so 38 slightly high but normal. Oxygen concentration is 98 to 100% and normal is 95 or above. Blood pressure, it's 120 to 80, normal, and here it is also normal. Respiratory rate is 18 per minute and the normal is 12 to 20 per minute. Everything is normal. Just look at the heart rate. The heart rate is 117, but in normal cases it must be 60 to 100 beats per minute. So the patient is slightly tachycardia, has a slight tachycardia. Okay, now we check the vitals, but now what will be the action? See, the main action will be to decrease the heart rate, means to bring the heart rate to normal before we can start any treatment. He is slightly tachycardic. So how we will bring it to normal tachycardia? We will give normal saline infusion, 500 ml saline or N5 bolus or lactated ringer bolus. In all these cases, after we means through the arteries IV, we will give it IV, intravenous, not artery, sorry, IV means intravenous. The tachycardia, the heart rate will come down, but BP will slightly increase, which is means it is negligible, but the main thing is we must decrease the heart rate before we start anything. Okay, so we will give saline infusion or 500 ml saline or N5 bolus to decrease the heart rate and bring it to normal. After this, then we will investigate. Now comes the proper investigations to correctly diagnose it. Okay, so most important, before doing anything we must check the BMP or KM7. BMP or KM7, this evaluates several key electrolytes in blood and markers of renal function. BMP or KM7, chemistry 7, this shows us the condition of 7 important electrolytes in our body. It is sodium, potassium chloride, bicarbonate, blood urea nitrogen known as BUN, blood urea nitrogen, creatinine and glucose. These 7 checks. Now see, after that what we will do? We will do the CT of abdomen, CT scan to check it out. As we have found out there is a tenderness, so to confirm it we must do a CT scan. Key diagnosis for patient suspected with appendicitis. As he has right lower quadrant pain, so we will do a CT scan to suggest him. Now we also will do CBC. CBC means complete blood count. Complete blood count. Here we see RBC, WBC, platelets. So we can get approximately the figure what is happening or what the problem is. Just remember, if WBC is more, if means there is increase in the number of WBC, then appendicitis can happen. Means in 75% of cases, if WBC count increases, then appendicitis happens. Okay, these are the 3 tests which is critical, we must do. Why we will do BMP or KM7? Because to check all the 7 vital electrolytes. CT abdomen is must as it is related to abdomen, and complete blood count to check the RBC, WBC and platelets. Now after doing this, what are the results we get for this patient? Always remember, we are approaching the diagnosis for this patient. So after this, so what are the results? BMP or KM7, sodium normal, potassium normal, chlorine normal, bicarbonate normal, BUN normal, creatinine normal, glucose normal. Means all the electrolytes in body are normal. Just let us look what are the normal figures. For sodium it's 138 to 143, for potassium it's 3.6 to 4.9, and these are all millimole per liter except creatinine. Creatinine is micromole per liter. Just see the values, 101 to 105, 24, 28. Just you can check this. Means all are normal. BMP report. Now see CBC, WBC count increase and hematocrit count decreases. What is the normal WBC count? 3.2 to 9.8. But here it's 18.9. It is highly increased. This is also suggestive of appendicitis. And rest all are normal. Platelet, hemoglobin all are normal. Now CT abdomen. This will confirm our diagnosis. See, in CT abdomen, we see non-fluid filled edematous appendix. See, this is the appendix, which is clearly shown in the CT, which has been means there is no fluid filled, but it has increased in size. Appendix. This is the appendix. This one. This is the appendix. In the CT we can see. So we can say it is non-fluid filled edematous appendix. Now medications. We have found it all. The patient is having acute appendix from this. Now what are the medications that we will give? First, analgesics to relieve pain. The patient's main complaint was pain. So before we do appendicitis, means remove the appendix, we must give some painkillers or analgesics to reduce the pain. So to relieve the pain, one you can give fentanyl bolus IV, and IV it is intravenous. Remember why IV? Because the patient is already having loss of appetite, and means the mouth must means nothing must go through mouth. Fentanyl bolus is given IV, treats acute pain and short duration of action, and also it is given because it has short duration of action. Short duration, we don't need for much. Now we will relieve the pain, then do the surgery and it's okay. So analgesics. Antibiotics are given. Prophylactic antibiotics covering gram-negative bacteria are essential. Also metronidazole for anaerobic coverage. Antibiotics, because bacteria in the colon may be there. Maybe there no colon has bacteria, colon host bacteria. So we give antibiotics, and mainly gram-negative bacteria are given. Covering gram-negative bacteria, antibiotics covering gram-negative bacteria are given, and we also add metronidazole for aneurysm coverage. So what are the antibiotics that we will give? Cefoxitin plus metronidazole, or diperacillin plus tazobactam. This is a single agent. Diperacillin plus tazobactam. This is a beta-lactamase inhibitor, broad spectrum beta-lactamase inhibitor. Diperacillin plus tazobactam, and also antiemetic to prevent nausea, vomiting, metoclopramide. The patient was having vomiting and also nausea, so metoclopramide. These are the three types of drugs he will give. First, to relieve the pain he is suffering, then to stabilize it, means to give antibiotics, and then antiemetic. Now contact surgeon, appendectomy. After you have stabilized the patient, you have diagnosed it. See, this is the important diagnosis, the CT. This you confirmed. And how you reached here? By doing a proper abdominal physical examination. Okay, you reached there. This is it. And let us move to some extra notes. What are the extra notes about this? This is a general study to know a lot. Acute appendicitis, most common condition, leads to emergency surgery. This is the most common condition. This leads to emergency surgery. This is the only cure. Sometimes people might means without surgery, some may opt for means medical treatment or just staying on medications to relieve the pain. But that's not the ultimate cure. The ultimate and only cure is emergency surgery for appendicitis. Causes. What are the causes? Importance. Obstruction of vermiform appendix. See, this is the vermiform appendix. If this gets inflamed due to any obstruction, this causes inflamed appendix. This is the large intestine, small intestine. This is the large intestine, this is the small intestine. Sorry. This is the small intestine, and this is the large intestine, and this is the vermiform appendix near the colon. In children, most common cause is dehydration and viral infection. Just remember it. Classical presentations. How we will present? Firstly, right lower quadrant pain, loss of appetite, anorexia, loss of appetite, abdominal pain migrating to right lower quadrant, followed by vomiting and fever. See, this is the anatomical positions of appendix. Appendix may be found in various positions, but most common is retrocecal. Manifest with back or right upper quadrant pain. In retrocecal appendix, as you can see, it's going back. Retrocecal positions. There can be RUQ pain or back pain. RUQ means right upper quadrant pain. Different positions of appendix. 1 o'clock. The positions are mainly based on the timings. Means watch time. This is 11 o'clock, 1 or 2, like this. Remember, this is the most common. Physical exams and test. What are the physical exams? RLQ tenderness at McBurney's point. This is the McBurney's point. This is between ASIS. ASIS means anterior superior iliac spine and umbilicus. Between ASIS and umbilicus, 1.5 to 2 inches from ASIS. The line connecting ASIS and umbilicus and 1.5 inches away from ASIS. This is the McBurney's point. So you can feel a tenderness in this point. We said now we will do physical examination, so we will feel a pain at this point, McBurney's point. Now see, Rovsing sign. This indicates peritoneal irritation. What is the Rovsing sign? Background. See, indicative of this indicates acute appendicitis and right lower abdominal pain upon palpitation of the left lower abdomen. Means if you palpate on the left side of the abdomen, you will feel a pain here on the right lower quadrant. This is Rovsing sign. This indicates there is a peritoneal irritation. Swas sign. What is the Swas sign? This is the Swas sign. The Swas sign, pain on passive extension of the right thigh. When you passively extend the right thigh, while the patient lies on the left side, you can see this position. The patient is lying on the left side and we are passively extending the right thigh. The patient examiner extends patient right thigh while applying counter resistance on the right hip. Here it's filled. So if there is pain, then this is Swas sign. And other treatments are other exams are obturator sign. This is the obturator. Obturator sign, passive internal rotation of the right thigh. Here we will internally rotate the right thigh and there a pain might be felt. And in Swas sign, we will passively extend the right thigh laying on the left side. These are Swas sign and this is the obturator sign. This one obturator, this is the Swas sign. This is the Rovsing sign. Left side, if we palpate, we will feel a pain on right side. Pelvic examination for sexually active patient. This can be also done. We will do pelvic examinations for patients who are sexually active. Findings: CBC, WBC increases in 75% cases. As we told, increase in WBC is a critical factor for appendicitis. Standard evaluation: CT scan of abdomen and pelvis with contrast. This is the gold standard. Means if you we do a CT scan, if you find that there is appendicitis, we can clearly diagnose it. Thank you.